Okay, thank you very much, all of you. I'm okay. As was said, I'm Sanches. I'm from the Institute for Systems and Robotics. I'm from the board of directors at the Institute for Robotics. And I will address. I will try to be short. My presentation have strong overlaps with my colleague Miguel Constant, so I think I can speed up this presentation. So I will address two components of our research work on technological tools in psychiatry, and the overall project. This overall project aims at addressing the diagnosis and follow-up of psychiatric patients in holistic perspective, and of course you can look to the data from home, teleconsultation, hospital, and ambulatory. I think this part of the mobile apps was already referred in the previous presentation, so I will be focused on hospital and teleconsultation. So the conventional approaches are based on interview with the patient in the case of hospital, and you want to introduce an additional layer, an intermediate layer on this classical approach, basically by asking the patients to do a battery of tests before consultation under medical staff supervision. So the idea is to provide the medical doctor with objective indicators, objective measures of the mental state of the patient before the consultation. So the idea is that during the consultation, the medical doctor already has all the information obtained in this step. So this we have designed some procedures. Some of them already was referred here. Some of that related with writing, such as making the signature, transcriptions, and drawings. Movement, reaction times, making tests, and memory tasks. So all this data can be, all these tests can be done under medical staff supervision, which guarantees some guarantee accuracy and reliability to the patient. So all this the information acquired in this scope will be processed, of course, and scores are obtained in order to make it possible to present all this complex and huge amount of data in a very comprehensive and very clear way during the consultation, in order to the medical not spend too much time to understand this data. So the device that was already referred before is an instrumented pen, where you have basically two main functionalities. It has an accelerometer and an additional electronics to make it possible to make reaction times measurements in this case. So during the writing tasks, in particular signature tasks, the result of the task is obviously a signature, but there is a big difference in the dynamics of that procedure, depending on the mental state of the patient. In this case, just for illustrative purposes, we have. I'm showing here a very simple metrics, that is the average amount of movement of acceleration, in this case, in several signatures made in the morning and in the evening, in this case in a healthy subject. Of course, this is not to validate the method, it's just for an illustrative purposes, but you can see that during the morning you have an amount of acceleration less than in the and this is just to illustrate what you want to obtain from analyzing this data. You are able to discriminate different states. Okay. The other thing is basically you have the electronics in this device. It is able to implement the reaction time measuring, which is visual stimulus is produced randomly, and the patient need to press the button, and so you are able to measure the reaction time. So you can see in this case the measure from the same subject show that the reaction times in the morning are larger than in the evening, which is consistent with the previous case where we are measuring accelerations and not reaction times. So this is part of the process. You have more than tests, but I decided to show only this one. The other component is the teleconsultation, as Miguel already referred. So you have invested a lot this last year in this because you come up with experience from COVID. In fact, I and you have designed and developed methods for monitoring subjects or patients with COVID, and you transpose this to the mental health. So you have a platform, you have a video teleconsultation platform that basically is based on the classical and normal Zoom teleconference platform. And so it contains the standard video conference functionalities as expected, but we integrate in this platform, we integrate the information from the database where all the information of the subject, of the patient is stored. You are able to include and to make and to present that information in a very convenient way to the medical doctor during the teleconsultation. And additional, we also include additional information that we call augmented reality features that are extracted from the image. And in fact, you are able to extract amazing things from these images. Of course, the obvious one, the most obvious one, is the eye blinking rate. So you, by analyzing the image, you are able to extract a long time the eye blinking rate, the heart rate, and the heart rate variability analysis, and the head movement. So these are the three features that I will refer in the next few slides. Of course, you are also thinking to include include other analysis such as face expression analysis and speech analysis, which is of course the obvious solution. So the eye blinking is obtained from the analysis of the fiducial points from the face. Okay, so you are able to measure the opening area, the opening measure of the eye. Okay, and so you can measure this along the teleconsultation. So you are able to detect when the eye closed, and that points are closed, are clear, the point where the subject is blinking. Of course, there are some points like this and like this where the subject closed the eyes but is not blinking. But of course, you can make a single process on that, so you can solve the problem. So from this data, you can extract two important things. One, of course, is the eye blinking rate, as I told you, as I referred before. But the other thing is also important, is the average, the mean opening of the eye. Okay, so this course here represents how open or how close the eyes of the patients are, and of course, this is very important biomarker, mainly if you compare these curves with previous sessions, and so you can assess the effective of the therapeutic. So the movement of the head, of course, is important. You are tracking the central fiducial point in between the eyes, and so you can measure the movements in the y and x direction, and so you are represented here. And by combining both, you are able to quantify the total amount of movement in this during the teleconsultation. And in fact, the total amount and the amount of movement is important, but it is not the only it is not the only feature that is important. For instance, it is important to see what is the magnitude of the movement, if it is large or small. It is important to know if the movement is random or is regular or it is periodic, you see. So you can extract all that information just for tracking the movement of the head of the patient in the teleconsultation, in the video conference session. So finally, the last biomarker is the heart rate. In fact, by analyzing the intensity, the skin brightness of the patient, you are able to detect this variation that is basically the PPG of the patient. So you are able to detect the PPG of the patient by analyzing the color of his skin, and so you are able to extract the heart rate, the long and short-term heart rate, and here you are able to see if it is okay, because this film here from a public database contains the real PPG extracted at the same time. So in fact, you can see that you are able to extract accurately the PPG. Of course, there are some points that the quality of the signal can be degrade, because if the patient moves his face, but since you are tracking since you are also tracking the movement, you have methods to assess the quality of the signal, and you can discard that's part of the signal when the patient has moved. So if you are able to extract the PPG, you are able to analyze the variation of the heart rate along time, okay, by computing the intervals between QRS complements, not QRS, because this is not the ECG, but this is between these peaks. And then you can analyze the resulting RR signal, and based on this, it is very well established, you can make an assessment of the autonomic nervous system activation, and you can, I can represent that activation in a very, very clear way. I can represent the activation of the parasympathetic and sympathetic branches of the autonomic nervous system, so I can see a long time the evolution of this representation, so I can see if you are having more sympathetic or more parasympathetic activation. So this is very, very useful biomarker to include in the platform. So this is my presentation. These are the collaborators in this process, and so thank you very much for your attention.